How is IBS diagnosed?
Well, the diagnosis of IBS is based on having certain symptom criteria. So IBS, like other conditions like depression, fibromyalgia, interstitial cystitis, these are considered symptom-based disorders. There's not a blood test or a routine radiographic test that is going to be able to diagnose IBS. Now, what we use currently is something called the Rome-3 criteria, and these are symptom-based criteria. And basically, a patient meets the criteria for IBS if they have abdominal pain at least 3 days a month, and the pain has to be associated with 2 out of these 3 features. And what these 3 features are is that the pain is improved when you go to the bathroom, the pain occurs when you go to the bathroom more frequently or less often, and it's associated with a change in stool form, so more watery stools or very hard, lumpy stools. So the key of IBS is that you have a link between abdominal pain and a change in your bowel habits. Now, as I mentioned before, we don't have any blood tests for it, but studies have shown that it is important to look for alarm signs. Now, alarm signs are usually not present in IBS patients, and if they are present, you might be thinking of a different condition that can mimic IBS, like inflammatory bowel disease or celiac disease. And those alarm signs are blood in the stool, unintentional weight loss, waking up in the middle of the night having a bowel movement or diarrhea, a family history of colon cancer, inflammatory bowel disease, or celiac disease, or when your symptoms first start after the age of 50, because it's much more common to have IBS earlier in life. So that's the criteria we usually use, but in patients who come in with IBS, we usually try to screen for celiac disease. Studies have shown that it's cost effective to do that. But the other tests, it depends on how the patient presents, and a judicious use of diagnostic tests is what's advocated.